Have you ever felt like you were eating very carefully, controlling your sugar intake at every meal, but your blood sugar levels still fluctuate unpredictably? Why are there days when you eat so little, yet your readings are still high? The answer might lie in the things you thought were harmless, the vegetables you eat every day. I know, living with diabetes is not easy. Every day is a battle, from checking your blood sugar, planning your meals, avoiding complications, to silently worrying without saying a word. But the beautiful thing is, you are not alone. And today, I will be right here with you to clarify something very important. Not all vegetables are good for people with diabetes. In this video, you will discover 6 types of vegetables that truly help stabilize blood sugar, lower HbA1c, improve heart health, protect your vision, and 6 others you should limit if you do not want your condition to worsen. Just by adjusting a few vegetables in your daily meals, you can see noticeable results. So do not skip this video. At the end, I will share something that could change your entire journey in managing your blood sugar. Did you know that a bowl of spinach or kale each day can quietly help improve insulin sensitivity, lower blood sugar, and significantly reduce the risk of diabetic complications? It may sound simple, but leafy greens are actually one of the most powerful foods for people living with diabetes. Leafy greens like spinach, kale, or Swiss chard all have a very low glycemic index, usually under 15. This means that after eating these vegetables, your blood sugar does not spike suddenly. This is extremely important because, according to the American Diabetes Association, rapid spikes in blood sugar after meals are a leading cause of small blood vessel damage, which can lead to complications in the heart, kidneys, and nerves. 1 cup of fresh spinach contains only about 7 calories, 1 gram of carbohydrates, and nearly 0.7 grams of fiber. Meanwhile, cooked kale provides about 6 grams of carbohydrates, 36 calories, and up to 2.4 grams of fiber. So not only are they low in sugar, but they are also rich in fiber, a key factor that helps slow the absorption of glucose from the intestines into the bloodstream, keeping blood sugar stable over time. Beyond blood sugar control, leafy greens are rich in many essential nutrients that support overall health for people with diabetes. For example, magnesium, a mineral that supports insulin function, is present in 24 milligrams per cup of spinach. According to a study from Tufts University in the United States, getting enough magnesium can improve insulin sensitivity by up to 20% in people with insulin resistance. Moreover, leafy greens are rich in potassium, which helps balance blood pressure, a common issue among people with diabetes. Specifically, 1 cup of kale contains about 299 milligrams of potassium, helping to relax blood vessels and reduce strain on the heart. For those taking blood pressure medication or with kidney disease, you should consult your doctor before eating potassium-rich vegetables regularly. Leafy greens also provide abundant amounts of vitamin C and K. Vitamin C is a powerful antioxidant that helps reduce inflammation and protect cells from damage caused by high blood sugar. With each cup of kale, you get up to 28% of your daily vitamin C needs. Vitamin K, with 145% of the daily requirement in just 1 cup of spinach, plays an important role in keeping bones strong and blood clotting stable, especially since people with diabetes are at higher risk of fractures. One of the reasons leafy greens are highly valued is because of their plant compounds like beta-carotene and lutein. These are antioxidants that protect the eyes from macular degeneration, a common complication among long-term diabetics. Not only that, but they also help reduce inflammation in the body, a major cause of decreased insulin function. You might ask, how much is enough? The answer is about 1 to 2 cups of leafy greens per meal, depending on your tolerance and the amount of protein and starch you consume alongside them. The fresher and darker the green color, the more nutrients they contain. To get the most benefit, cook them lightly. Overcooking can destroy vitamin C and some lutein. The best methods are quick stir-frying with olive oil, light steaming, or eating raw in salads or smoothies. Here are some simple and highly effective dishes you can try. Spinach sautéed with garlic and olive oil. Quick, full of nutrients, and heart-friendly. Kale salad with lemon dressing and sesame oil, light yet energizing. Swiss chard stir-fried with tofu. Increases plant protein and fiber, great for digestion. Spinach smoothie with almond milk, frozen banana, and chia seeds, a great choice for breakfast. For breakfast, you can also add kale to scrambled eggs or blend spinach with Greek yogurt and berries. When combined with protein like chicken breast, salmon, or lentils, Leafy greens make a balanced meal that keeps you full longer and reduces sweet cravings mid-morning. However, there are a few things to avoid when preparing them. Do not stir-fry with too much oil or fat, as this will reduce the health benefits of the light meal. Avoid using sauces or dips with sugar like mayonnaise, sweet sesame sauce, or pre-made dressings with hidden sugars. Do not pair them with toppings like croutons, candied butter, or processed meats. Instead, use natural seasonings like lemon, garlic, black pepper, apple cider vinegar, and healthy oils like extra virgin olive oil. It is important to choose fresh greens, not wilted or yellow-spotted ones. Fresh vegetables not only taste better, but also retain nearly all their vitamins and minerals. If you are in the late stage of kidney disease or have high potassium levels, consult your doctor before regularly eating potassium-rich vegetables like spinach and Swiss chard. With all the benefits mentioned, leafy greens not only help stabilize blood sugar, but also lower HbA1c over time, improve insulin sensitivity, and reduce the risk of complications like blindness, kidney failure, and heart disease. A study from the American Journal of Clinical Nutrition found that people who eat leafy greens at least 5 times a week reduce their risk of diabetic complications by 20% compared to those who eat them less than once a week. If you are not yet used to eating leafy greens daily, start slowly. A small bowl lightly sautéed with olive oil each day can already make a difference. You will feel noticeable changes: less fatigue, deeper sleep, and more stable morning blood sugar levels. If you are looking for a type of vegetable that is refreshing, helps stabilize blood sugar, and is easy to incorporate into every meal of the day, then zucchini and cucumber are indispensable choices. Not only do they have a very low glycemic index, under 15, but these two vegetables also offer a range of practical benefits for people with diabetes, from weight control to improving kidney function and reducing inflammation effectively. Zucchini, also known as young squash, has a very low carbohydrate content, only about 3 grams of carbs in every 100 grams, providing around 20 calories and nearly 1 gram of fiber. Meanwhile, cucumber, also known as baby cucumber, contains only about 4 grams of carbs, 16 calories, and 0.5 grams of fiber in the same amount. With a water content of over 95%, both of these vegetables help keep the body hydrated, thereby reducing the risk of sudden blood sugar spikes after meals, a factor that many people often overlook. When the body is dehydrated, the liver releases more glucose into the blood, leading to high blood sugar even when you have not eaten much. This is why water-rich vegetables like zucchini and cucumber become silent companions that help stabilize blood sugar every day. In addition to easily digestible fiber and abundant water content, zucchini is also a strong source of vitamin C, with about 35% of the daily requirement in just a small cup. Vitamin C is an important antioxidant that helps calm inflammation, protects cells from damage caused by high blood sugar. Inflammation is one of the leading factors that reduce insulin function and accelerate the development of diabetic complications such as heart disease, kidney disease, and peripheral neuropathy. Cucumber, though lighter in vitamin C, stands out with vitamin K, providing about 14% of the daily need in a small portion. Vitamin K plays an important role in regulating blood clotting, maintaining bone density, and improving vascular health. 3 factors that are especially important for people with diabetes, particularly from middle age onward. Special plant nutrients in zucchini, like the flavonoids, luteolin, and camphorol, have been shown to reduce inflammation, increase insulin sensitivity, and support cardiovascular health. A study published in the American Journal of Clinical Nutrition found that supplementing plant flavonoids from vegetables like zucchini may help improve HbA1c levels and slow the progression of vascular damage in people with type 2 diabetes. Not only are these 2 vegetables good for blood sugar stability, but they are also ideal choices for those wanting to lose or maintain a healthy weight. With extremely low calorie content yet providing a lasting feeling of fullness due to high fiber and water, zucchini and cucumber help reduce hunger without raising blood sugar. Another special feature, cucumber contains very little potassium, making it more suitable for people with diabetes who also have kidney problems. Zucchini has a moderate amount of potassium, still safe if consumed in reasonable amounts. For those in the late stages of kidney disease, it is best to consult a doctor before consuming zucchini frequently. So how much should you eat? A serving of 1 to 2 cups per day is ideal, depending on how you combine it with other food sources. Because of their very low GI, you can eat zucchini and cucumber in all 3 main meals or as snacks, helping to reduce hunger between meals without raising blood sugar. Preparing these two vegetables is very simple. Cucumber can be eaten raw in salads, juiced, or made into smoothies combined with spinach, lemon, and a bit of unsweetened yogurt. Zucchini can be quickly stir-fried, roasted, or transformed into zoodles to replace rice noodles or pasta, a wonderful option for reducing carbs in main meals. Here are a few recipe suggestions for you. Zoodle with pesto sauce and grilled chicken breast, a delicious, refreshing dish that keeps you full for longer while maintaining stable blood sugar. Cucumber salad with mint and lime juice, cool, easy to make, and perfect for hot days. Smoothie with cucumber, spinach, and Greek yogurt, rich in water, low in carbs, good for digestion and blood sugar. When preparing, avoid using too much oil or salt. Zucchini easily absorbs oil, so if you stir-fry it with too much olive oil or butter, the dish will become high in calories, counterproductive to weight loss and blood sugar stability. Instead, stir-fry quickly with minimal oil and use lemon, garlic, or herbs to enhance flavor. A common mistake is using bottled sauces that contain a lot of sugar when mixing cucumber salad or seasoning dishes. Read food labels carefully, or better yet, make your own dressing with apple cider vinegar, extra virgin olive oil, and a little sea salt for both delicious taste and safe blood sugar levels. Note when purchasing: choose fresh zucchini and cucumber with smooth skin, firm to the touch, no spots or cracks. Fresh vegetables have much higher nutrient density compared to those that have been stored for a long time or prepackaged. Some recent studies have also shown that regular use of zucchini and cucumber can help lower fasting blood sugar, reduce HbA1c, and improve insulin sensitivity by 10 to 15%. For those who are just starting to manage diabetes or have been on medication for a long time but still have difficulty stabilizing blood sugar, incorporating these simple vegetables into the diet can be a gentle yet effective breakthrough. If you are looking to improve your daily meals without spending much, without changing too many habits, then zucchini and cucumber are smart and sustainable choices. Try adding 1 serving per day and listen to your body. Your morning blood sugar will become more stable, the feeling of bloating after meals will ease, and your energy will last longer throughout the day. If there is a type of vegetable that is colorful, delicious, and offers comprehensive benefits for people with diabetes, it would be bell peppers. The vibrant colors of bell peppers, red, yellow, orange, and green, not only make meals more visually appealing but also hide within them a treasure trove of nutrients that help stabilize blood sugar, boost immunity, support vision, and protect the heart. The glycemic index of bell peppers is around 40, placing them in the low to medium range. Although not as low as leafy greens or cucumbers, they are still safe to eat in reasonable portions. What is special is that in each cup of raw bell peppers, you only take in about 6 grams of carbohydrates, 2 grams of fiber, and just 37 calories. With a relatively high fiber-to-carb ratio, bell peppers help slow the absorption of sugar into the blood, thereby preventing sharp spikes in blood sugar after meals. Biologically, the soluble fiber in bell peppers forms a gel-like layer in the intestines, slowing down the conversion of starch into glucose. This helps maintain blood sugar at a steady level for longer periods and also reduces hunger after eating. This is a crucial factor that helps people with diabetes avoid snacking or sugar cravings between meals. But bell peppers do more than stabilize blood sugar. Each cup of red bell peppers can provide up to 169% of your daily vitamin C needs. This is an impressive number, especially for those living with diabetes, a condition that constantly exposes the body to oxidative stress, inflammation, and weakened blood vessels. Vitamin C is not only an antioxidant but also plays a role in protecting the small blood vessels in the eyes, kidneys, and peripheral nerves, areas that are easily damaged when blood sugar remains high for extended periods. Research from McMaster University in Canada has shown that adding vitamin C from vegetables such as bell peppers helps reduce overall inflammation and improve insulin sensitivity within a few weeks. Bell peppers are also a rich source of vitamin A, especially red ones, which contain about 30% of your daily needs in just a small portion. Vitamin A plays a role in protecting vision and strengthening the immune system, which is important since people with diabetes are more susceptible to infections and eye complications such as diabetic retinopathy. What stands out most are the natural pigments, carotenoids like beta-carotene, lutein, and zeaxanthin, which are present in high amounts in red and orange peppers. These compounds have the ability to reduce inflammation, protect pancreatic cells, regulate insulin production, and slow down the progression of atherosclerosis. A study from the Journal of the Endocrine Society in the United States demonstrated that carotenoids can help improve insulin sensitivity by up to 15% when regularly consumed through natural foods. 1 cup of bell peppers per day not only helps reduce HbA1c, but also significantly lowers the risk of cardiovascular complications, thanks to their ability to soften blood vessel walls and lower blood pressure. Unlike high-potassium vegetables like spinach, bell peppers contain a moderate amount of potassium, about 211 milligrams per serving, making them suitable even for people with kidney problems when used properly. One thing to note is that the color of bell peppers affects their nutrient content. Red varieties are the richest in vitamin C and carotenoids, followed by yellow, orange, and then green. However, all types offer good benefits for people with diabetes if consumed correctly. In terms of portion size, 1 cup per day is reasonable and easy to follow. You can eat them raw, lightly stir-fried, or roasted to retain their crunch and distinctive flavor. Avoid overcooking or boiling for too long, as this can destroy up to 30 to 50% of the vitamin C and natural antioxidants. Here are some simple recipes to try at home. Stuffed bell peppers with quinoa and black beans, a plant-based dish that is low in carbs and high in fiber, supporting digestion and blood sugar control. Stir-fried bell peppers with chicken and sesame oil, balanced in protein, fiber, and healthy fats. Hummus with roasted bell peppers, a quick snack that does not require much cooking and can be paired with cucumbers or whole grain rice crackers. Omelette with bell peppers and cilantro, ideal for a filling breakfast that does not spike blood sugar after meals. For breakfast, you can also add bell peppers to a smoothie if you enjoy a milder flavor. Combined with spinach, Greek yogurt, and a slice of fresh fruit, it creates an energizing smoothie that is still friendly to blood sugar. When preparing, avoid using too much cooking oil or sugary sauces, especially bottled sauces like sweet soy, barbecue, or cheese sauce. Instead, season with lemon juice, balsamic vinegar, or extra virgin olive oil, all of which are tasty and healthy. When shopping, prioritize fresh, glossy, firm bell peppers without black spots or soft areas. Avoid pre-cut packaged products, as they often contain preservatives or lose part of their nutrients from long exposure to air. An interesting fact is that people who frequently eat bell peppers tend to experience fewer sugar cravings, a common symptom in type 2 diabetes. This is because bell peppers help regulate blood glucose levels and influence hunger-controlling hormones such as ghrelin and leptin. With all these benefits, bell peppers deserve a spot in the daily meal plan for people with diabetes. They are not only easy to prepare and eat, but also play a protective role for pancreatic cells, improve insulin sensitivity, and help prevent complications related to the heart, eyes, and blood vessels. Broccoli, also known as green cauliflower, is not just a regular vegetable often seen in stir-fried or steamed dishes. For those living with diabetes, it can be seen as a natural shield that protects the pancreas, blood vessels, and nervous system from the effects of prolonged high blood sugar. The first thing that makes broccoli special is its very low glycemic index, around 15. This means that after eating a portion of broccoli, blood sugar levels hardly fluctuate. Furthermore, this vegetable provides a significant amount of fiber, which helps slow the digestion of starches and keeps blood sugar stable for hours. 1 cup of cooked broccoli provides 5 grams of carbohydrates, including 5 grams of fiber, which means it contains virtually no pure sugar. With just 55 calories per serving, broccoli is an ideal choice for those needing to manage both weight and blood sugar. But the nutrition of broccoli does not stop there. A small portion also provides 135% of daily vitamin C needs to boost immunity and fight inflammation caused by high blood sugar, 116% of vitamin K to support blood clotting, increase bone density, and protect small blood vessels, 457 milligrams of potassium, a moderate amount that helps regulate blood pressure while remaining safe for those at risk of kidney problems. The vitamin C in broccoli acts as a powerful antioxidant that protects pancreatic cells from damage caused by high glucose levels. When the pancreas becomes inflamed or its function declines, insulin production decreases, making blood sugar harder to control. Many studies, including one from Harvard University, show that regularly eating broccoli can improve HbA1c by 0.5 to 1% within 8 to 12 weeks. A special highlight of broccoli is sulforaphane, an antioxidant compound found primarily in cruciferous vegetables. Sulforaphane has been shown to reduce inflammation and provide antioxidant protection at the cellular level. protect pancreatic cells from damage, and maintain stable insulin production. Improve endothelial function in blood vessels, thereby reducing the risk of atherosclerosis, the cause of heart attacks, strokes, and kidney failure. A study published in the American Journal of Clinical Nutrition found that people who eat broccoli 3 to 4 times a week have a 30% lower rate of nerve and blood vessel complications than those who eat it less than once a week. Additionally, the fiber in broccoli helps lower bad LDL cholesterol, regulate digestion, and reduce appetite. These are critical factors for people managing their weight as part of diabetes treatment. Regarding digestive health, broccoli also provides insoluble fiber that supports the gut microbiome, increases beneficial bacteria, and reduces the risk of intestinal inflammation, a silent condition that can affect insulin regulation. With all these benefits, broccoli deserves a place in your daily diet. A serving of 1 to 1.5 cups per meal is appropriate for the body to absorb all the nutrients without worrying about excess potassium or fiber. Broccoli can be prepared in many ways. However, because vitamin C and sulforaphane are easily destroyed by excessive cooking, you should use gentle methods such as quick steaming for 3 to 5 minutes to retain the dark green color and nutrients, stir-frying on high heat with minimal oil for no more than 4 minutes, light roasting in the oven with olive oil and garlic to maintain flavor and boost the absorption of vitamin K and carotenoids, eating raw in salads if you have a strong digestive system. Here are a few recipes you can try immediately. Roasted broccoli with olive oil and garlic, crispy outside, tender inside, and great for heart health. Creamy broccoli soup with Greek yogurt, light and fragrant, yet suitable for a weight loss diet. Stir-fried broccoli with ginger, sesame, and shiitake mushrooms, balanced in protein, fiber, and antioxidants. Raw broccoli salad mixed with apples and almonds, nutritious, refreshing, and supports effective digestion. For breakfast, you can add steamed broccoli to an omelet or blend it with spinach and frozen banana to make a low-sugar smoothie. When combined with protein sources like eggs, tofu, chicken, or salmon, broccoli helps create a well-balanced meal that slows down sugar absorption and keeps you full longer. A small note: if you are being treated for thyroid disease, consume broccoli in moderation because it belongs to a group of vegetables that contain goitrogens, substances that can affect the thyroid if eaten in large amounts raw. However, lightly cooking it reduces this effect while still retaining most of the benefits. When shopping, choose a broccoli that is dark green, firm, and free of brown spots or softness. Fresh vegetables are not only more delicious but also preserve all the essential enzymes needed for anti-inflammatory action and immune support. In summary, broccoli is not just a good vegetable for diabetics. It is a natural savior that helps prevent complications, control blood sugar, improve vascular health, and maintain comprehensive well-being over time. There are some vegetables that are so familiar that we tend to overlook them, thinking they are ordinary, but in fact they hold tremendous power for health, especially for people with diabetes. Green beans, also known as string beans or snap beans, are a prime example. Simple, easy to prepare, affordable, and widely available, yet they quietly work as warriors, helping to control blood sugar, improve digestion, and protect the heart. The glycemic index of green beans is only about 15, putting them in the very low category. This means eating green beans does not cause sudden spikes in blood sugar, even when eaten with starchy foods like rice or potatoes. 1 cup of cooked green beans provides 7 grams of carbohydrates, including 4 grams of soluble fiber, only about 31 calories, 12% of daily vitamin C needs, 20% of vitamin K, 2 grams of natural plant-based protein. The abundant fiber content in green beans is a key factor that slows glucose absorption in the small intestine, thereby helping keep blood sugar levels stable after meals. For people with type 2 diabetes, this change can reduce fatigue and drowsiness after eating, while also lowering fasting blood sugar the next morning. In addition to fiber, green beans also contain flavonoids, a group of natural antioxidants that help reduce inflammation in the body, the underlying cause of most diabetic complications such as nerve damage, retinopathy, kidney issues, and microvascular disease. A study published in the Journal of Clinical Endocrinology showed that a diet rich in flavonoids from tender green beans can improve insulin sensitivity by 10 to 15%, lower HbA1c, and stabilize plasma glucose levels within 3 months. Regarding digestive health, green beans support bowel movements, reduce constipation, cleanse the intestines, and increase the number of beneficial bacteria in the colon, which helps eliminate toxins from the body more efficiently. When the body has fewer toxins and more stable blood sugar, the pancreas can work more gently, allowing better disease control without increasing medication doses. Another interesting fact: the fiber in green beans also binds to bad cholesterol, LDL, in the intestines and helps eliminate it. This is why this vegetable helps reduce the risk of atherosclerosis, a common complication in people with diabetes over 50 years old. Not only good for blood and vessels, green beans also contain a moderate amount of potassium, not as high as spinach or bananas, so they are suitable for people with signs of kidney function decline. Potassium helps regulate blood pressure, support a steady heart rhythm, and reduce blood vessel tension, a hidden cause of kidney damage in diabetics. When it comes to the immune system, green beans also play a positive role. With 12% of vitamin C per serving and many trace minerals like manganese and folate, green beans help strengthen immune defenses and fight off bacteria and viruses, which is very important for people with diabetes, who are more prone to infections than the general population. Another plus is that green beans help with weight control. With low calorie content but high in fiber and water, eating green beans helps you feel full quickly and stay full longer, reducing appetite and supporting better blood sugar control. So how much should you eat? A serving of 1 to 1.5 cups per day, rotated through meals, is completely appropriate. The best preparation methods to preserve nutrients include light steaming for 4 to 6 minutes to keep the green color and crisp texture, quick stir-frying with olive oil and garlic, light boiling and mixing in a salad with flaxseed oil and sunflower seeds. Here are some easy recipes to try. Stir-fried green beans with mushrooms and chicken breast, rich in protein, low in carbs, and heart-friendly. Steamed beans with toasted sesame and apple cider vinegar, light, flavorful, and anti-inflammatory. Green bean salad with cherry tomatoes, sunflower seeds, and unsweetened yogurt dressing. A light, easy-to-digest dish that is good for blood sugar. Tender green bean soup with lean meat, simple to cook and provides complete nutrients without raising blood sugar. For breakfast, you can lightly stir-fry green beans with eggs or make a vegetable omelet with beans, bell peppers, and spinach, adding protein while maintaining energy until noon. Some notes when using green beans: do not overcook them, as prolonged high heat will destroy vitamin C and break down flavonoids. Avoid using too much salt, soy sauce, or seasonings that contain sugar. When shopping, choose fresh beans with even green color, firm texture, and no brown spots or softness. If you are looking for a versatile vegetable for health, good for blood, heart, kidneys, and also easy to cook and combine, green beans are a trustworthy companion. Try incorporating them into your daily diet and feel the difference: a lighter body, more stable blood sugar, and a calmer mood. Cauliflower, also known as white cauliflower, may appear simple, but it holds powerful benefits for stabilizing blood sugar, reducing inflammation, and offering comprehensive protection for the heart, nervous system, and pancreas. Especially for those living with diabetes, cauliflower is a smart and versatile choice that can be turned into dozens of delicious dishes while still supporting effective treatment. Regarding glycemic index, cauliflower has a GI of about 15, meaning it hardly raises blood sugar after eating, even when paired with starchy dishes like brown rice or sweet potatoes. 1 cup of raw cauliflower provides about 5 grams of carbohydrates, 2 grams of fiber, 25 calories, 77% of daily vitamin C needs, 20% of vitamin K, 320 milligrams of potassium, a moderate level suitable for those with kidney concerns. Cauliflower contains both soluble and insoluble fiber, which help regulate blood sugar by slowing glucose absorption in the intestines. Fiber also provides a lasting feeling of fullness and reduces cravings, allowing people with diabetes to control calorie intake and maintain a healthy weight. Beyond fiber, the highlight of cauliflower is sulforaphane, a potent antioxidant that protects pancreatic cells from damage caused by high blood sugar and reduces inflammation in small blood vessels, kidneys, and the retina. A study published in the Harvard Health Journal showed that supplementing sulforaphane from cruciferous vegetables like cauliflower for 8 weeks helped reduce fasting blood sugar by an average of 11% and significantly lowered HbA1c in patients with type 2 diabetes. Vitamin C in cauliflower not only boosts immunity, but also reduces chronic inflammation and fights free radicals, 2 main causes of diabetes complications. When combined with vitamin K, cauliflower strengthens blood vessel walls, reduces bleeding risks, and helps wounds heal faster, which is especially important for people with diabetes. With a moderate amount of potassium, 320 milligrams per serving, cauliflower is a safe option for people in the early stages of kidney problems. Potassium helps keep blood pressure stable, regulates heart rhythm, and improves blood circulation to the lower limbs, which are often affected by diabetic neuropathy. One lesser-known benefit of cauliflower is its support for fat metabolism. Certain compounds in this vegetable help activate detox enzymes in the liver, reduce blood fat, and indirectly improve insulin sensitivity, a vital factor in blood sugar control. When used properly, cauliflower helps to improve insulin sensitivity, lower fasting blood sugar, reduce HbA1c, prevent vascular complications, support digestion and relieve constipation, reduce bad LDL cholesterol, strengthen the immune system. The recommended amount is 1 to 1.5 cups of cauliflower daily, divided between main meals or used in side dishes. The best cooking methods to preserve sulforaphane include light steaming for 4 to 6 minutes, quick stir-frying on high heat, or eating raw in salads. Overcooking will reduce vitamin C by half and destroy the enzyme that activates sulforaphane. Here are some simple and tasty cauliflower recipes. Cauliflower roasted with turmeric and olive oil, golden, aromatic, anti-inflammatory, and antioxidant. Mashed cauliflower as a substitute for mashed potatoes. Smooth, low in carbs, ideal for a light dinner. Raw cauliflower salad with sunflower seeds and cucumber. Crisp, refreshing, and rich in digestive enzymes. Cauliflower rice, a replacement for white rice, perfect for those needing to reduce starch but still feel full. When shopping, choose cauliflower with firm heads, creamy white color, and no brown spots or softness. Avoid damp or foul-smelling heads, as they may have reduced nutritional value and be more susceptible to bacterial growth. One important note: people with thyroid disease should consume cauliflower in moderate amounts and always cook it, as this vegetable contains goitrogens, which may affect the thyroid if consumed raw in large quantities. However, once cooked, this effect is almost eliminated. Cauliflower can be easily combined with good protein sources like salmon, lentils, chicken breast, eggs, or mushrooms to create a balanced and blood sugar-friendly meal. Additionally, cauliflower can be used to make low-carb pizza crust or creamy white sauce with unsweetened plant-based milk, suitable for those who need to control cholesterol and calories. The simpler and more accessible a food is, the more impactful it can be. Cauliflower is clear proof of that. Include it in your diet as part of a comprehensive healthcare strategy, not only to manage blood sugar, but also to boost immunity, protect your heart, and maintain your body's resilience over time. We have just explored 6 types of vegetables with low glycemic index that help stabilize blood sugar, support the heart, nervous system, and kidneys. Whether familiar like spinach, cauliflower, or green beans, when used correctly, they can make a significant difference for people living with diabetes. You do not have to change everything at once. Just start with 1 serving of vegetables each day, stay consistent with small changes, and you will feel your body getting stronger and your mind lighter with each passing day. If you found this video helpful, please click like, subscribe to the channel, and share it with your loved ones who are concerned about diabetes. And do not forget to leave a comment. I would love to hear about your health journey. Wishing you good health, peace, and stable blood sugar always. See you again in the next videos.